Hello everyone, now let us discuss about anatomy of urinary system part 2. In the current session, we will be discussing the blood and nerve supply of the kidneys. The reason why kidneys are supplied with abundant blood vessels is because the kidneys remove the waste from the blood and regulate its volume and ionic composition. They are supplied abundantly with the blood vessels. And although the kidneys constitute less than 0.5% of total body mass, they receive 20 to 25% of the resting cardiac output via the right and left renal arteries. They receive 20 to 25% of the resting cardiac output via the right and left renal arteries. In adults, the renal blood flow, the blood flow through both the kidneys is about 1200 ml per minute. In the adults, the renal blood flow is about 1200 ml per minute. Within the kidney, the renal artery divides into several segmental arteries which supply different segments of the kidney. Each segmental artery gives off several branches that enter the parenchyma and pass through the renal columns between the renal lobes as the interlobar arteries. Segmental arteries divided into interlobar arteries. A renal lobe consists of a renal pyramid, some of the renal column on either side of the renal pyramid, and the renal cortex at the base of the renal pyramid. And at the base of the renal pyramids, the interlobar arteries arch between the renal medulla and cortex. Here they are known as arcuate arteries. Arcuate means shaped like a bow. The divisions of arcuate arteries produce a series of cortical radiate arteries. And these arteries radiate outward and enter the renal cortex. Here they give off branches called efferent arterioles. AF means towards, ferent means is to carry. Efferent arteriole means to carry towards. So each nephron receives one efferent arteriole which divides into tangled ball-shaped capillary network called the glomerular. And the glomerular capillaries then reunite to form efferent arteriole. EF means out, that carries the blood out of the glomerulus. Efferent arteriole, it brings blood into the kidneys, into the nephron, and the efferent arteriole, it carries the blood out of the glomerulus. The glomerular capillaries are unique among the capillaries in the body because they are positioned between two arterioles rather than between an arteriole and a venule. The significance of glomerular capillaries is unique because they are positioned between two arterioles rather than between an arteriole and a venule. Here you can see the schematic representation. The first one is the renal artery. So, renal artery, it is divided into segmental arteries. Segmental arteries are divided into interlobar arteries. They form arcuate arteries and they form cortical radiate arteries. And from that, efferent arterioles are seen. This efferent arteriole, from the efferent arterioles, blood enters glomerular capillaries, and from efferent arterioles, it enters the peritubular capillaries. From that, it enters cortical radiate veins, arcuate veins, interlobar veins, and renal vein. This is the order of blood supply of the kidney. Here you can see this is the efferent arteriole and this is the efferent arteriole. This is coming towards and this is going away. EF means out. AF means coming towards. And this is the peritubular capillary and this is the cortical radiate vein, and these things are the vasa recta. Because they are a capillary network and they also play an important role in urine formation, the glomeruli are considered part of both cardiovascular and the urinary systems. The efferent arterioles divide to form peritubular capillaries. Peri means around, which surround the tubular parts of the nephron in the renal cortex. Extending from some efferent arterioles are long loop-shaped capillaries called vasa recta. Vasa means vessels, recta means straight. Vasa recta that supply tubular portions of the nephron in the renal medulla. And the peritubular capillaries eventually reunite to form cortical radiate veins, which also receive blood from the vasa recta. And then the blood drains through the arcuate veins to the interlobar veins running between the renal pyramids. The blood leaves the kidney through a single renal vein that exists at the renal ileum and carries venous blood to the inferior vena cava. Many renal nerves originate in the renal ganglion and pass through the renal plexus into kidneys along the renal arteries. The renal nerves are a part of sympathetic division of the autonomic nervous system. Renal nerves are a part of sympathetic division of the autonomic nervous system. And most of the vasomotor nerves that regulate the flow of blood through the kidneys by causing vasodilation or constriction of the renal arterioles. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.